How's it going, everybody out there? Coach Mark here, and today what we're going to be discussing is testosterone replacement therapy, or better known as TRT. So, this topic has been gaining a lot of traction over the past recent years due to some of the health conditions that it can be used for treatment, right? But of course, any medical treatment has its pros, its cons. So, we're going to be going over some of the benefits and the risks. And again, I'm not a licensed practitioner, so this is just for educational purposes only. If this is something you're interested in using or going through the protocols, please consult with your physician or a licensed hormone replacement therapy clinic. So for today, you're not going to need much more than a pen and a pad. Just listen along, take some notes, and I hope you enjoy the video. So first things first, what is testosterone replacement therapy, or TRT? Testosterone replacement therapy, as the name suggests, involves the administration of testosterone to individuals whose bodies are not producing sufficient levels naturally. It is commonly prescribed to men experiencing symptoms of low testosterone, a condition known as hypogonadism. TRT can be administered through various methods, including injections, gels, patches, and pellet implants. So another thing I'd like to discuss, because I think it's really important, is what is the actual mechanism of TRT? So testosterone plays a crucial role in numerous physiological processes, including muscle mass and strength, bone density, libido, mood regulation, and cognitive function. TRT works by restoring testosterone levels to within the normal range, thereby alleviating symptoms associated with low testosterone. The exogenous testosterone introduced into the body through TRT supplements the body's natural production, effectively addressing hormonal deficiencies. All right, so now that we talked about the mechanism, I'd like to go over some of the other things that definitely are important when it comes to testosterone replacement therapy, especially if this is something you're considering and doing, is knowing what comes along with it. So we're going to be talking about the pros and the cons, obviously, but I want to mention your natural body's shutdown of testosterone. So because you're introducing an exogenous testosterone or hormone into your body's natural process of producing that hormone shuts down. The reason that being is because your body already thinks it's creating enough testosterone so that it doesn't think it needs to create any more. So the natural process shuts down, like I said, and that's basically what comes along with replacing a hormone, especially testosterone. Another thing that a lot of doctors don't recommend, unless you're actually going to a licensed and certified hormone replacement clinic where they specialize more so in hormone replacement, is taking HCG along with it. Now, there's debates whether you have to or not. I feel that this is very important. It's my personal opinion that you do, because what HCG does is, so that's the hormone that's released from your pituitary gland, and it signals the testicles to continue the production of testosterone or sperm. So I think that that's important, because what happens is when your natural testosterone shuts down, that's why you hear the term shrinkage, right? Or, testicular atrophy is basically where your testicles shrink down to almost nothing. They atrophy. So by continuing with the HCG protocol, it continues to provide that natural mechanism of producing the testosterone, keeping your testicles a little bit more on the fuller size and not a complete shutdown. Another thing, too, to be mindful of is some people are a little bit more estrogen sensitive. So we know that when we introduce a hormone like testosterone in our body utilizes so much of it, and then the rest of it converts into estrogen, right? And that's not good, because then that comes with a whole heap of side effects. So if you're somebody who's estrogen sensitive, and the only way to find this out is if you're actually going through the protocol and you're tracking and monitoring your blood work, your doctor should say, okay, you're running a little high in estrogen. We might need to put you on an estrogen blocker. So basically, what that does is it's more so of a conversion blocker, and it's called anastrozole. So anastrozole stops the conversion from testosterone into estrogen and keeping your estrogen levels at where they properly should be, right? Because as a male, you do need estrogen as well. However, testosterone needs to be your primary sexual hormone. Now that we got some of that stuff out of the way, let's go over the good stuff. So we're going to talk about the pros of TRT. But remember, with pros comes cons. So, one of the first pros we want to talk about here is an overall improved quality of life, because I feel that's pretty important. So, testosterone replacement therapy can alleviate symptoms such as fatigue, decreased libido, and mood disturbances, leading to an overall improvement in the quality of your life. And one of the most known pros and notable ones would be the increased muscle mass and strength. Testosterone is essential for muscle protein synthesis, and TRT can help individuals increase muscle mass and strength, particularly when combined with regular exercise. Another benefit to mention would be enhanced bone density. So, testosterone plays a crucial role in maintaining bone density, and TRT can help prevent osteoporosis and reduce the risk of fractures in individuals with low testosterone levels. And another very popular pro would be improved libido and sexual function. So, low testosterone levels can lead to decreased libido and erectile dysfunction. TRT can help improve sexual function and restore libido in affected individuals. All right, and I'm sure everybody who's been doing their research has heard and read up on the pros, but now we're going to talk about some of the cons. So I'm not really discussing anything new. I'm just talking about some of the well-known pros and cons of TRT replacement. It's just if you're wanting to keep yourself informed, I believe you need to know both sides of it. So now we're going to go over the cons of TRT and what you might consider if this is something that you're looking to get into. So, of course, the first one we want to mention is the risk of side effects, right? Like any medication, if you take too much of it or any medication at all, has a list of side effects associated with it. So, basically, the risk of side effects include acne, fluid retention, breast enlargement in males, and worsening in sleep apnea. Another one to discuss would be cardiovascular risks. So some studies suggest a potential association between TRT and increased risk of cardiovascular events such as heart attacks and stroke, particularly in older men or those with pre-existing cardiovascular conditions. So as I mentioned before, TRT can suppress and will suppress the body's natural production of testosterone and sperm production, leading to infertility in some men. Another con that I feel is highly mentionable would be the monitoring and compliance of it. So TRT requires regular monitoring of testosterone levels and potential side effects, as well as a strict adherence to treatment protocols to ensure safety and efficacy. So if you feel like you're suffering from symptoms of low testosterone, it's best to go to your physician and get your blood work done and make sure you do a full hormone panel to see where your levels are, because TRT does offer some significant benefits, as we mentioned, the quality of life, muscle mass, bone density, sexual function, but of course there are some risks associated with it. That's why it's best to be self-educated and do your research before talking to your doctor, and then going through the process of seeing if there's something that is right for you. So you always want to consult with your physician. And best thing that I would say is to, if your doctor is someone who doesn't really dabble in hormone replacement, then it's best to find a certified and very well reputable hormone replacement clinic where their doctors there specify and specifically targeting and leveling out hormones for men and women. In my experience, I am somebody who is on testosterone therapy, and it has benefited me because I was suffering through some symptoms when I reached my mid-30s, up until I was on testosterone therapy, and it completely changed my life and made me feel a lot better. But that's my experience. Everybody has a different experience. Again, this is something that you will want to do your research on, talk to your doctor, consult with the physician, and make sure it's right for you. Well, there you go. That's it. That's your pros and cons for testosterone replacement therapy. There's a lot more research out there that you can find. If you liked the video, go ahead and hit that like button and subscribe to the channel, and we will see you on the next one.